say that it is equivalent to the Delta variant ng transmissibility.
Some hospitals in Quezon City are now overwhelmed with COVID-19 patients as active infections in QC continue to rise.
Hinaharap na ninyo kami. Hinaharap na ninyo ang tagal ng DOH. Hinaharap ninyo ang lahat ng mga kasama ko dito. Hindi kami makaharap sa mga tao dahil lahat ang dami-daming sinasabi, ang dami-daming paratang.
Ito yung 67.3 billion deficiencies. Alam mo, I am not criticizing anybody, especially itong kuha. But I've been mayor. Imposible magnakaw ka ng 67.3. But to the issue of whether the money has been stolen, that is pure bull.
More than 6 million vaccines are arriving this week as COVID-19 cases continue to rise, and the ECQ will end by Friday. Should government extend the lockdown or impose tighter quarantine restrictions? We discuss in this episode of The Chiefs. Welcome to this special edition of The Chiefs. I'm Robbie Alampay. Kasama po natin Ami Pamintuan of the Philippine Star, Lucy Cruz Valdez of News 5, and Ed Lingao of One News. Chiefs, good evening.
Good evening.
Good evening. Happy Tuesday.
Ami, ano bang recommendation? Lumabas na ba recommendation, and what are we expecting tonight?
Wala pa eh. Iniintay, nag-uusap-usap pa sila eh. So ang pinag-uusapan ngayon, syempre, yung mga sinabi kagabi ni Presidente na tinitira yung
COA.
Commission on Audit, saka yung mga appearance ni Health Secretary Duque, of course, before the lawmakers, masama ang loob niya. At yung balita nga na namatay yung nag-prepare ng report, although namatay pala siya before the President issued his statements. No?
Okay. Well, anyway, sige, we'll get to understand in the meantime, or we hope to try to understand more, as always, about the COVID-19 situation. Ipasok na natin ang mga guests natin. Now joining us, Professors Guido David and Ranjit Rai of Octa Research. Good evening, Professors David and Rai.
Good evening, Professor.
Good evening,
Hi, sir.
Hi, good evening.
Mukhang si Dr. David pa lang. Doc, let's start with as always the numbers. What are you seeing, and what should we expect by August 20, when this ECQ, this phase of the ECQ officially supposedly ends and may possibly be reconsidered?
Well, Robbie, daya nyo, ini-invite nyo ako pag Tuesday. As in, may Tuesday dips sa numbers. So temporarily, what we're seeing are good numbers. I mean, at least, over the past several days, mataas yung numbers sa NCR. In fact, we reached 4,000 cases just yesterday. Pero ngayon, in the NCR, 2,380. I know it's a Tuesday dip, pero we can still hope na the numbers will at least start to slow down from here. Yung reproduction number, which was 1.9 sa NCR, because of this dip, bumaba siya, 1.78. I mean, it's not guaranteed to be permanent itong dip na to, but at least yun nga.
Yeah, but Dr. David, on the other side of the Tuesday dip, are you also anticipating or bracing for a swing by August 20? Because you've been saying this the past 2 weeks. By August 20, we should be seeing what if the chaos in Las Piñas and Manila were super spreader events.
Well, they might have been. I don't have access to data kung masasabi natin na talaga nag-cause sila ng super spreader, but we did see high numbers in Metro Manila for the past several days, and we were concerned na yung ECQ was not working as well as we hope it would. It's working naman because nag-slow down din naman yung reproduction number compared to before ECQ na bumilis siya ng bumilis, nag-accelerate siya. And as we mentioned this sa laging handa kanina, it usually takes mga 4 weeks din naman bago makita yung downward trend from the start of ECQ. So ibig sabihin, if we go with that, mga first week of September pa natin, if ever, makikita yung start ng downward trend. But of course, there are still some aspects that are medyo concerning. Medyo mataas pa yung positivity rate natin sa Metro Manila. And then yung hospitals natin are starting to become full. In fact, yung numbers natin are not, based on numbers, may spaces pa sa hospitals. Pero based on what we're hearing on the ground, mahaba na yung waiting list sa mga hospitals. Many hospitals are now feeling feeling the strain. And ganun man, even though sa NCR, it looks like, it's starting to improve, it's not the case sa Calabarzon and sa Central Luzon, which are starting to, let's say, heat up. Umiinit na yung numbers dito, bumibilis yung pagdami ng cases, many LGUs in Central Luzon and Calabarzon. Calabarzon maybe except Quezon Province, pero Central Luzon sa Bataan, sa Bulacan, maraming LGUs na dumadaming cases.
Sir, but even if you're having a Tuesday dip, sir, that would still be proportional to the number of cases to the number of people that were tested, di ba? In other words, the positivity rate would still be consistent dapat kahit bumagsak yung aggregate numbers. In which case, how are we seeing the numbers in the last so many days? Kasi today, 22.2 yung positivity rate, kahapon 23 point something.
Right.
Are we stabilizing? Pero sabi nga ninyo kanina 4 weeks pa dapat bago maramdaman yung effect ng ECQ . So what is this in effect? Is it a plateauing or what?
Well, it could be stabilizing, Ed. And tama ka nga, if the positivity rate decreases, that's actually a good sign, even if we are expecting the dip. Kasi if it's a dip na walang change sa trend, the positivity rate should be about the same. Pero ganun yung sinasabi naman namin na although we're seeing a slowdown sa NCR, in other areas it's actually speeding up, and that's why maka-counter yung effect ng sa NCR. And overall, our numbers, we're projecting that the numbers will still rise. It's very likely abutan ng 15 to 16,000 by next week. We might even hit that this week pag nawala ng But mostly outside the NCR. Yun yung concern natin. Right now, NCR, Central Luzon, and Calabarzon, nasa 63% ng range yan . 63% of total cases nasa NCR, Central Luzon, and Calabarzon.
So it doesn't look like So it doesn't look like it's gonna go down by the 20th enough for the Metro Manila mayors to gain a little bit of confidence about loosening up a bit. It doesn't look that way.
It doesn't look that way, Luchi. We're hoping it would, pero maybe they'll have confidence. There's some pressure, I think, na i-move na to MECQ, maybe a strict MECQ. And kami naman, wala si Ranjit dito who usually makes the recommendations. Pero our position naman is, we'll go with the decision of the IATF. But if we ease to an MECQ, it can still work. Pero we need to really scale up yung other yung other interventions natin, yung testing. We should be testing more. In fact, we should be doing more of parang closer to mass testing. And then yung contact tracing, we don't have data on that, pero dapat i-scale up din natin yan. Not just scaling up hospitals, pero yung mga early intervention strategies, yung isolation testing and contact tracing.
In fact, I remember yung original proposal niya is a hard lockdown para nga malaki yung gains within the 2 weeks. Kaya ngayon, ang sinasabi ng mga tao compared to last year's ECQ, ito ngayon yung EASYQ daw ito. Kaya kino-compare nila ngayon, halimbawa, New Zealand, isa lang yung nadagdag na Delta, isang Delta, nag-lockdown yung buong bansa, Kung kayo, sa tingin nyo, what can be done? Well, apart from, of course, increased testing and contact tracing, by way of restrictions, you think pwede pang gawin tong harder lockdown?
Well, Ami,
Kaya ang pwede.
right, and that's a good point, Ami. In fact, na-mention din namin yan na if the government decides to extend the ECQ, maybe para masulit na at matapos na agad instead of prolonging the agony, baka pwedeng higpitan na natin yung restrictions because even the DOH said na yung mobility now is higher compared to yung mobility nung March lockdown and nung August last year na lockdown. Ibig sabihin, mas maraming tao going about. And ako, I don't really go out much ngayon. I stay home mostly. Pero when I do drive, papansin ko, ang bigat ng traffic, parang nasa GCQ nga yung traffic eh. So nagulat nga ako parang, I thought, ECQ. But yun, I think we could make it more strict kung mag-i-ECQ na rin tayo, para ano na rin, yung parang sinabi natin dati, parang one time, big time, para mas mabilis nang ma-control yung cases instead of, parang tinitingin natin yung quarantine natin. I mean, I'm not saying na dapat mag-ECQ. I'm just saying, kung mag-i-ECQ na tayo, let's do it the way we've been doing it in the past. Again, if they decide to go MECQ, they could maybe do a stricter MECQ or something.
Pero sir, if you're projecting 50 to 16,000 by next week, I can't imagine how the IATF or anybody in government could justify downgrading to MECQ. I mean, di ba, offhand, that would sound counterintuitive, especially if you're going to hit 16,000 by next week as projected.
Yes, Ed. And the problem is, yun nga, siguro sa NCR, we might have some hospital beds and ICUs still available, at least on paper. Pero sa Central Luzon and sa Calabarzon, maraming areas dun na, mataas na yung ICU utilization nila I mean, or occupancy nila. A lot of them are in critical level, ibig sabihin 85% occupancy. So, and if we downgrade right now to an MECQ, of course, the concern is tataas pa yung mga hospital occupancy, especially sa NCR. And in fact, ngayon, tumataas pa siya. Even if
71%.
Right. Even if mag-reduce na yung number of cases natin slowly, because right now we're averaging more than 2,500, which is about the surge capacity natin sa hospitals. What that means is, as long as we're averaging mga 2,500 to 3,000 and above, hindi bababa yung hospital admission natin. It will remain or it will increase. Yun yung nakita namin So we have to really reduce that number of cases bago kumonti yung magpapa-admit sa hospitals.
Dr. David, you alluded to this earlier. Maybe you could just expound on it a bit. Ilan na ang as you said, it's no longer just Metro Manila as the epicenter. Ilan na ang kinakount nyo as major centers that's driving the spread? And among those centers, is there any particular engine that's really glaringly taking a different trajectory?
Right. Okay. Again, that's a good question, Robbie. And may mga iba akong dadaanan muna, like for example, Western Visayas. They actually requested me to make a small report sa Western Visayas, sa Aklan, because Aklan was having a real surge. Mataas pa yung attack rate sa Aklan, but they have managed to control it. So medyo nagsastabilize na yung trend sa Aklan. And so sa Western Visayas, it looks okay now. Sa Cebu area, Cebu City, cases are still high. It's still the worst surge compared to March. Pero it has slowed down some. So, pero tumataas pa rin yung cases, pero medyo mabagal na yung pag-increase niya. So there is somehow managing to control it, pero yun nga, tumataas pa rin siya. And then sa Ilocos region, nagde-decline ng cases. So what we're seeing now, siguro, Tuguegarao, outside of the NCR+, some spots in Mindanao, like Cagayan de Oro, medyo tumataas pa rin yung cases. Davao City, na-control na for a while, pero medyo nagkakaroon na konting pagtaas ulit. And then, aside from that, mainly NCR, Calabarzon, and Central Luzon. Pero ang bumibilis talaga sa Calabarzon and Central Luzon. Sa NCR, we're seeing a little slowdown, pero nag-accelerate sa Calabarzon and Central Luzon. And this is a problem kasi we have to address this. I don't know, maybe through granular lockdowns, localized lockdowns. Kasi even if mag-healing NCR, a lot of workers umuwi sila sa Calabarzon, sa
Yes.
Central Luzon. I mean, we can't, how do we control the borders kung ganon? These are maraming essential workers. So this is something that we'll have to address sometime in the near future. How do we keep NCR okay? I mean, once it heals, while at the same time managing yung Calabarzon and Central Luzon.
Okay, one of the justifications for the lockdown was to buy time. To buy time to vaccinate people specifically. How is that coming along now? I mean, are we succeeding in terms of buying time to vaccinate more people so that we can project what would be a safe time to open up and not worry about hospitals getting full because there are just so many unvaccinated?
Well, that's a good strategy in theory na we buy time so we can vaccinate people. Kumbaga nag-uunahan tayo eh. For example, for the common person, anong mauna sa akin? Mauna ako ma-vaccinate or mauna akong
Yes.
ma-Delta variant? And
Right.
in a way, it's a race. It's sort of a dangerous race kasi, pag naunang Delta variant, we
It
don't know what
is.
would happen. Right. It is a dangerous race because it's a race for your life in a way. Ang problem is mas mabilis yung Delta variant. I mean, we're vaccinating as fast as we can, and I like seeing the numbers na dumadaming vaccinations natin. But we can only vaccinate so much, and right now I don't think we've hit 30% of NCR population. So I have to check the numbers. Pero based on what I saw last time, parang hindi pa naman umabot sa 30% fully vaccinated in the NCR. I know I think mga 12% fully vaccinated in the entire country. So, ibig sabihin, we can't really depend on that strategy na, uunahan natin ma-vaccinate. We really have to control the pandemic at this point through some other means. Not necessarily lockdown. I mean, lockdown's one way. If we could scale up, sinabi natin, yung mass testing, yung contact tracing, that would be another way. Or if people, practice extra caution, that would also be another way kasi, I mean, if nobody goes out, wala nang makakuha ng virus. But there's a lot of transmission going on in households, children getting getting infected based on the numbers that we saw. Tumaas na yung percentage sa NCR, I think 11% na yung children, dati 7% pa lang, yung mga below 17. So dumadami din yung infection sa mga bata. So these are things na, we have to, address kasi they're major concerns. We can't just depend on the vaccination rollout, which is going good, pero yun nga, it's a race kasi.
Professor David, pasensya na po. We need to take a break, but please hang on. We have more questions for you. Please stay with us. The Chiefs will be right back. Welcome back, the Chiefs here on One News. I'm Robbie Alampay. Kasama po natin Lucy Cruz Valdez, Ami Pamintuan, and Ed Lingao. We are still in our conversation with Professor Guido David of Octa Research. And I'll hand off to Ami. I know Ami was wanting to ask a question earlier.
Yes, Professor. Merong mga nagsasuggest kasi pwede kayong mag-granular lockdown eh. Pwede ba yung citywide lockdown within Metro Manila? How feasible is that? Kasi hindi naman lahat medyo napakataas, ano? Is that feasible considering the vaccination rate and the spread of Delta?
Citywide lockdown is, it's interesting. Well, alam natin Metro Manila is highly interconnected.
Yes.
So it would be medyo more difficult to implement. But, if they could do it, this would actually, be, maybe a worthwhile strategy to consider. And as we said, dumadami na yung vaccinations. Although sa San Juan, they're still getting their fair share of infections, even though marami na silang vaccinated. In fact, they have the highest vaccination rate per population, per capita. Pero they're still getting infected. And a lot of those who are getting infected are mga unvaccinated. And as we mentioned, mga 17 and below who are, yes, of course, also not vaccinated. So, pero, yun nga, I mean, this could be a strategy. I mean, kami naman, in terms of strategies, we, maybe we can look at strategies, pero we really just look at the numbers na, okay, pag may strategy tayo, we can tell you, is it effective? Is it working? Or we can tell you, oh, it's not working. And that's why, siguro, at that time when we were seeing a rise in numbers and it wasn't stopping, I mean, parang ang sinabi namin, well, wala na strategy nag-work, so maybe it's just the lockdown's the only strategy that will stop the rise in cases. Pero, if we have alternative strategies that will actually work, kasi ginagawa rin naman yan sa ibang countries. And in fact, I heard yung sa PCCI yata, sabi na, maybe we should think about yung data privacy and
Yes,
maybe
yes.
let's do electronic contact tracing. I would support that strategy. If it will help us beat COVID. We're just really looking at how to beat the pandemic. I don't know. Maybe we could waive the the Data Privacy Act or something. I know some people might not like that, but again, we're dealing with a public health crisis here. So I think whatever strategy will work or is viable, pwede rin naman tingnan yan.
In the meantime, Professor, vaccination, of course, remains the most important weapon. How does that, if you could discuss a bit, how is that factoring in right now in the models? And the counterfactual of it. In other words, kumbaga, if we weren't at this point in vaccination, where would we be? And in terms of the reality on the ground, because as you said, we have about 12 million people vaccinated already, what has that done? What does that do to your models?
Yes, and that's a very good question, Robbie. And how does that factor? We can look at the rate of vaccination. Kunyari, sabihin natin, 80% pa yung unvaccinated. So how let's say 20% fully vaccinated, 80% pa yung unvaccinated sa Metro Manila. So yung effect nun sa reproduction number is it decreases it by to 80%. So I will give some medyo hard numbers. I mean, I know some people don't like math. Pero kunyari, sabihin natin yung reproduction number na dapat kung walang vaccinated would be 2, yan ang hawaan, because we've vaccinated 20%, naging 1.6 na lang. So, nakabagal siya ng reproduction number, parang gano'n. Nadi-discount yung reproduction number in the same way kung ilan yung vaccinated. So, in terms of your second question, what would have been the effect kung walang vaccinated? We can actually look at that kasi ibabalik lang natin yung reproduction number without the discount. So, kunyari ngayon, we hit 1.8 na reproduction number. Kung wala tayong vaccination, nasa 2 plus na dapat yan. I think it would be around 2.25, which would mean mas marami na sanang nahawaan ngayon. And mas marami na rin namatay compared to the numbers that we're seeing. I don't have the exact numbers because I will have to look back at the model and babalik yung reproduction number na mas mataas. But that just gives us an idea na yun nga, kung walang vaccination, this is what we would be seeing. We would be seeing more people infected, more deaths, more critical cases. Baka by this time, baka overwhelming hospitals natin already instead of now na nagsisimula pa lang mapuno sa NCR.
Prof, kayo ba, kasi 1.5 years na tayong ganito, no? And you mentioned earlier that we should have more contact tracing. Nakita nyo ba na nag-improve yung contact tracing over the last, let's just say, 6 months? Just to be fair, no? Have we really, has the government really worked on improving the contact tracing? Huwag ko na nga isama yung genome sequencing kasi alam naman natin wala tayong magagawa masyado doon. But at least yung contact tracing. Has it improved?
Yeah, that's a very fair point, Lucy. And I would say naman, in all honesty, the contact tracing has improved. Pero even if we improve it, we're still limited by yung capability ng manual contact tracing, which is what it is for the most part. What it means is yung mga contact tracers, they call people, they text them, they follow up, and sometimes may hindi pa na-reach. Hindi nila ma-contact yung contacts na itong na-expose. So there are limitations to the actual strategy itself. Yun yung system. Yun yung problem. Like, for example, sa Taiwan, they have a very good contact tracing system, which I know because I heard their ambassador talk before. So they use a digital system, which again goes back to the data privacy thing. So if the country is willing to adapt that kind of strategy, and if we have a digital contact tracing app, malaking maitutulong yan, yes.
So mutually exclusive yon na parang if you go digital, you're gonna give up on the data privacy? And if you, ganun ba yun? I mean, there's no way you can actually have a system that also protects data privacy.
Well,
ensures data
right.
privacy.
That's a good question. I can't really answer that. I'm not even a legal expert, so I can't really even comment about yung data privacy law. So I'm not sure if it's mutually exclusive. Maybe there's a way naman, as you said, na we could still have data privacy and still have a contact tracing app. Of course, we know na may apps na ginagamit, may mga stay safe, may QC pass, problem, may mga problem, right? And not interoperable, and I don't know how they work, so I just scan them, and I haven't heard from any of these.
But at the rate kasi that variants are forming, and there's always a threat of a variant that has higher transmissibility, di ba? Parang, I agree with you that contact tracing should really move in step kahit papano, di ba? With kasi bilis ng variant And,
right, exactly. And yun nga, if we want to have a strategy na walang lockdown, I know a lot of people don't like lockdowns. Dapat walang lockdowns. And assuming, people cooperate at some level, that's why very important itong contact tracing. And also the testing, not just testing what we're testing now, but testing more than what we're testing now. In fact, kailangan something close to mass testing or mass randomized testing. Because I was speaking to Mayor Toby, and sinabi niya, they were testing yung mga health protocol violators sa city niya, sa Navotas, which is why medyo mataas yung cases sila. So they go out, yung mga hindi nakasuot ng face mask, they take them, they test them, and then they got a 15% positivity rate out of them. So ibig sabihin, 1 out of 7 of these people na nasa streets are, they have they have they could be super spreaders, and if they don't test them, hindi natin alam na nagkalat na pala sila because they're not even following health protocols. So that's why testing should be at that level na mataas if we want to we could have that with granular lockdowns, mass randomized testing, not even mass testing, right? Randomized lang, and then yung contact tracing na digital. I mean, we won't need hard lockdown for that because we have other systems in place.
Okay, Dr. Guido David of Octa Research, we'll have to let you go Sir, in the meantime, maraming salamat po. Always a pleasure.
Thank you po.
Pleasure.
Thank you.
Okay, sir. Ingat po.
Bye.
And we're continuing this conversation, of course. Now joining us in the final stage of our conversation, Deputy Speaker and Cagayan de Oro City Representative Rufus Rodriguez. Good evening, Congressman Rodriguez.
Good evening.
Good evening, Robbie.
evening
And
po,
good
sir.
evening,
Sir.
Ami.
Gabi.
Good evening, Lucy and Ed. Good evening.
Opo. Siyempre, sir, habang pinapag-usapan natin ang COVID, ECQ, bakuna, very intense scrutiny on the performance of the DOH to the point that kanina we saw Secretary Duque really getting emotional and laying it bare. It is affecting him as well, as it understandably would. But also to the point that President Duterte told him, wag mo kasing pansinin niyang COA. And in fact, sinabi niya sa COA, tigilan niyo na nga yan, nanggugulo lang kayo. Your reaction, sir, to the President's words?
Well, I think, the President's words, with due respect, is unwarranted because the COA is just performing its constitutional duty. The duty to audit, to scrutinize income and receipts of government as well as expenditures of government. And this particular annual report for 2020 is a mandate that every agency will have to be checked, and COA will look into its activities and expenses, and so they are also obligated to come out with their report every year. At the end of the year, there will be a report, and the report of COA, as stated by Chairman Mike Aguinaldo, it is a subject of conferences with the agency, exit conferences, and so forth. So that is the annual report, and so the President would not be able to say that COA should not make a report, or COA do not make a report, or that the agencies will not mind that report.
What about the reaction of Secretary Duque that right now their hands are full, and this is an exceptionally different situation. So reports like this only serve to delay them and to also demoralize the ranks within the DOH. What's your reaction to that?
Well, I believe that, public office is a public trust. When you are in government with your Secretary of Department of Health, and, you are doing all of these things, you just have to really accept what are the findings of COA and move to be able to address them. So you don't have to be emotional. Of course, he was also talking about those also with him in the DOH. It's true. The doctors of the DOH, hospitals, and also the nurses are doing their best. But on the other hand, there is also a finding of COA, and he should not have sleepless nights on that. He should be able to face the problem, get his best answers and best fulfillment, and try to comply with the requirements of COA. So that is my reaction to his statements this afternoon.
Congressman, ang sinasabi ng Department of Health and even President Duterte, yun daw findings sa preliminary. Saka based pa, hindi pa daw kumpleto yung report, mag-accounting pa raw sa audit. Tapos yun ang sinasama ng loob na nila Duque, ni Secretary Duque, na masyado daw maagang inilabas yung report, bakit daw pinost kagad. Hindi pa daw tapos yung deadline nila for explaining nga yung deficiencies. Bakit daw nilabas kagad? Yun ang sinasabi nila. So what do you think of that?
Well, Ami, the report came out in July, no? Ang period of examination is January 1, 2020 to December 31, 2020. Before it came out in July, there has already been many conferences. There has been due process already, as explained by Chairman Mike Aguinaldo. So it's not really that initial. It is already a final audit report for the year, and it's just subject to some explanation, which they're allowed to. Now, under the letter of the COA, it says, DOH, you have 60 days. That is between the executive and the Independent Commission COA. Congress, si Speaker Velasco and also Chairman Singson, to be able to go into a hearing immediately, because people cannot wait, Ami. Well, we wait for 60 days for there to be some answers to the issues of 67 billion deficiency. So it was a proper thing to do for our Congress to go ahead. We have the oversight function. Chairman Singson is right in saying that let us have their answer. And to the credit of Secretary Duque, there were also answers which resolved certain issues. They also admitted that on December 31st, 2020, there had been unobligated allotments. There had been naglaps yung ibang funds. Some do not have the proper MOA, like the 42 billion that was transferred to the procurement service of DBM, not anymore with the DOH. So all of these things, there is a basis for the COA to come out with a report.
Okay, Congressman, puntahan po natin yung content nung report, no? Labas na tayo doon sa proseso ng paglabas and how it should be taken by the DOH. But yung doon, I mean, one thing, COA went out of its way as well also to emphasize the operative word is deficiency. It's a technical term for editors, auditors, and as government has also asserted, deficiency does not necessarily mean anything was stolen, not necessarily.
Yeah.
The DOH was also framing that a lot of this has to do with documentation, a lot with reporting, and so on. All of that as a given, when you look at the content, what is the biggest thing, nonetheless, that to you DOH should report and explain to the public?
Well, first really is to me, the 11 billion unliquidated allotment. So unobligated funds. Meaning, if it is unobligated, it cannot be spent anymore after December 30, 2020. And out of that, they were able to explain 5.1 billion of that because according to them, 5.1 billion of the 11 billion is a continuing appropriation for 2021. But the problem is about the 6 billion. Yun. So they admitted that some amount, like about 1.9 billion, it was returned already. So the point really of the report, especially Director Doris Ugay and Chairman Mike Aguinaldo, the fact that it was not obligated, that these amounts were not spent, it's already a disadvantage and a bad effect on our situation because we need those funds to buy materials, equipment, and of course to pay our health care workers. So the fact that they were not spent and others have no documentation, that's already really a problem. And that is why it has to really be answered. And precisely the hearing was conducted to hear their side so that the people will already know what are the defenses of the DOH.
Well, sir, the president's statements were pretty firm and impassioned, to say the least. I'm wondering what would be the effect or what could be the effect of the president's statements on, number one, on the Commission on Audit, and on number two, the members of his cabinet, whom he told to just ignore future COA findings.
Well, as far as the effect of his pronouncements to the COA, it was clearly stated by Mike Aguinaldo, chairman, that they have to continue to be able to examine accounts and to be able to report. And to the cabinet members, well, they all know that the COA is independent from the executive department. These are constitutional commissions, independent and given specific functions under the Constitution and to look into receipts, income, and expenditures of the government.
Yes, sir. But even the president should know that as well, diba? I mean, the president's a lawyer, but still he made a statement.
Yes,
I asked a question in that respect. The cabinet secretary should know that, but the president should also know that. So in that sense, what do you foresee?
Well, the president always would, he would defend, of course, his cabinet members, and it is his thinking that these are just all preliminaries, and so that is his opinion. But the Constitution stays solid and effective, and the Constitution says that the COA is an independent constitutional body that really has to go into examination of all expenditures of government.
Anong consequences nun sa mga cabinet members who actually follow the president's directive to ignore COA findings? Meron ba yung criminal or administrative liability if you ignore
Well, I don't.
used to explain to COA kung ano nangyari sa pondo? Apart from a possible graft case, of course.
The president says that, but I'm sure that the cabinet will also know what the constitution provides and the powers of COA. And if they will ignore that, they are not able to answer. For example, if DOH will not answer the annual report and it will not be able to explain and to be able to comply with the observations, this will turn into a notice of disallowance. And if the notice of disallowance is based on bad faith, is based on the fact that there was no compliance with the procurement law, there can be, after notice, ang procedure dyan, after notice of disallowance, is a notice of charge, and then the ombudsman can bring the case to the ombudsman. So that is the effect. If they will follow, if they will say, disregard the COA, my goodness.
What about the effect naman on, on our fight against COVID, no? I mean, especially offhand pa nga, the fact that you're now, sabi nga ni Secretary Duque, taking their time off from fighting this pandemic to answering all of these allegations, no? But apart from that, does this affect, for example, how Congress will probably, draft the budget? Well, not what you draft the budget, but as far as the approval of the GAA, I mean, will that affect Congress in any way going into 2022?
Yes, that's why when Secretary Duque asked for my support, I said, yes, we always support the DOH, but it should not be the same as 2020. When we have 67 billion in deficiency, you should be able to correct this, to explain this, get all the documentation so that all of this will be properly be accounted for. And then in this year, 2021 budget, make sure na magasto na natin lahat so that it will reach our people already. That's what I told him. And when that is shown, that you have complied with the requirements of 2020 as required by COA, and you perform a good job in 2021, then we will be able to give you more in 2022. But if not, then we will be scrutinizing, the 2020, whether they have that absorptive capacity to be able to
Speaking of which, Congressman, I'm just really genuinely curious, and maybe for our education, you've been a public servant for a long time. You work with public servants, maraming sa LGU, sa executive. Why does that happen? Unobligated funds, both from good faith all the way to bad faith. What are the different factors that lead to ayan na yung pera, hindi pa nagamit?
Yes, I think really it's difficult to explain that, because the budget for 2020, for example, was approved in 2019. So you go running, take off running in January of 2020. And then, of course, the Bayanihan 1 was approved sometime in May. So therefore, they have time. And Bayanihan 2 was in fact extended to June 30. So there is really no excuse to be able to not obligate these funds. And that is why this is one of the findings of COA. So now that it's already out, by 2021, we hope that the Department of Health will be able to really spend them and spend them properly. Huwag natin sabihin na matagal kasi yung region magsasubmit ng mga receipts and all the documentation. No, they should also know the regional should also be directed to immediately send all these documents. So we don't want this to happen again in 2021, so that services will not be delayed. And what is budgeted for this year should already be given, like the payment of the special risk allowance from January to June 30, the purchases of the PPE. Ang problema pa dito, 42 billion of the 67 billion, yung 42 billion, transfer nila sa isang agency, sa DOH, which is the procurement service of DBM. Now, to me, it should have been really DOH who should have done that, because they are the most knowledgeable. What are PPEs? What are ventilators and all of that? So it's given to the PS, to the procurement service of DBM. And then the problem, and that's why COA saw it, there is no memorandum of agreement. There are no documents of this transfer that you legally transfer 42 billion to one, to the procurement service of DBM, PITC, andyan din, and then local government units. So they should really make sure there is proper documentation.
So, Congressman, listening to you, mukhang hindi kayo fully convinced about the explanation ng Department of Health so far sa pagharap.
Well, there are also good explanations that continuing appropriation, that they have authority like meal allowance, that cash equivalent will be given. So I think it runs both ways. No? There are also explanations which are very acceptable, and we accepted them. But there are also explanations which, for example, the loss of some obligated allotment of 2 billion and the loss of the foreign assisted projects, where they are still going to ask for reissuance of SARO. It's not a very good explanation because they should have done that already before December 31, 2020. So, okay lang yun. No? So, there's an exchange of idea. We have already an idea ano yung mga naging na-explain nila, ano naman yung hindi pa na-explain.
Yung reklamo ng mga nurses, nagtetress
Yes.
na sila ng mass resignation eh. Is that
Yes.
yung complaint nilang yan?
It's a valid complaint. In fact, yes, we also heard the representative from St. Luke's and an association of workers, of healthcare workers in the private sector. They have not been paid their special risk allowance, which should be from January to June 30. August na tayo eh. The same is true in Cagayan de Oro. That is why I really made sure I was present this afternoon, because not only are the macro issues, the 67 billion, I am really going to ask, because there is already a planned mass protest of our own nurses and healthcare workers in Cagayan de Oro. It's circulating in the social media. They have texted me, the nurses. So I asked about the payment. So luckily we get the commitment of the secretary that this week they will pay all the special risk allowance of all healthcare workers in public and private hospitals in Cagayan de Oro. And that the meals, accommodation, transportation, they're only asking money from the DBM that to comply with the law that we have to give, the DOH has to give MAT, meals, accommodation, and transportation. And the commitment that, kasi June 30, nawala na yung, yung Bayanihan 2 eh. How about those health workers who will get sick, who will die in this fight against COVID-19? So wala na, but they are looking for funds, and they said they will continue to give benefits. What are these? This will be 15,000 for sickness of health workers if they are mild or they are moderate, 100,000 pesos if they are severe, and 1 million for a health worker who dies. And so therefore, there are commitments also done during the hearing this afternoon.
Does it look like they're going to be able to answer all the questions on deficiencies within the next 60 days? Because that's our deadline, right? Sa dami na mga binibring up nyo ngayon na issues, tsaka mga detalye. Does it look like this is all going to be answered? And, well, they will be let off the hook, kumbaga.
Well, Luchi, we cannot say that because they really have 60 days. So we really hope that they're able to answer this and produce all the documentation. We are not really sure after 60 days, because after 60 days, clearly, once they file, and they should do it before 60 days, then the issues are joined. Here is the finding, and then here is the answer. And then they will sift through all the records, and it can lead to notice of disallowance and notice of charge, or it can end if clearly they're able to explain everything. So it's speculative for us to say that they may not be able to answer also all these issues. Some, in fact, they said na resolved na out of 13. 13 ito lahat eh. Ang findings under the annexes are 13. And they have said 5 have been resolved, but another 5 is ongoing, 3 are still in the process. So, ganon. So, at least may mga answers sila. And let us wait for that.
Sir, by any chance, is there any middle ground here? Kasi the President says naman that he is not stopping COA from conducting its audit. He just doesn't want COA to be making public its initial findings until a final report is done. legally, is there any middle ground, or should there even be a middle ground?
No, there is really a requirement for COA to come up with this annual audit report. And it should be finished, in fact, earlier. In fact, I'm wondering why it came out in July, because December 30 is about 7 months ago. So it's really because they're so busy, the COA. So that is why what we're saying is that it is a public document. It is in the website. Everybody can access this report. It's just that everybody looks into this because it's 67.3 billion. Yeah.
Okay.
So-
Congressman, balikan ko lang isa sinabi niyo kanina na may commitment na hindi. Yung mga utang natin sa mga health workers, lalo na sa ma-release na yan. Kung totoo yun, ma-release na, then what was the problem? What was the bottleneck ultimately?
Talagang medyo hindi sila fast in being able to process. Because, for example, the special risk allowance, that is 5,000 a month, it is mandated by Bayanihan 2. So, nagbayad na up to December. But August na ngayon, hindi pa bayad. Like in Cagayan de Oro, I am in touch with our health workers there. Hindi pa bayad January to June 30, 2021. August na ngayon. So when we asked the regional director there, he said that the money is in fact already in. But there are still requirements of MOAs and all of these requirements. So I believe that they really were quite lax and did not immediately implement the provisions of Bayanihan 2 as far as the special risk allowance is concerned, as far as the meals, accommodation, and transportation. The hazard pay have been paid because hazard pay is only up to December 30, 2020. So therefore, wala na yan. Pero ang SRA, tuloy-tuloy, up to June 30 lang. Hindi pa rin bayad, but they have committed that Robbie, that we are going to be paid within this week, according to Secretary Duque.
But for the release of COA findings, is there a specified timeline specified by law?
No, not really. Yeah, it's just
Sinasabi nyo, July na eh. Bakit July lang nilabas?
Yes,
Pero specified timeline.
Yeah, there must be, but considering really that there are just so many agencies to be examined and so forth, and of course, a big budget is given to DOH because of the pandemic. So, may leeway yan eh. Even kung may requirement in their own rules, that can be subject to, being able to extend. Kasi, so in fact, I believe that it should be earlier, but they came out just this July. Yeah.
Okay.
So, yeah.
Okay.
I was going to ask.
Go ahead, Lucy. Go ahead, Lucy. May time pa tayo.
Just last question na lang. Does it look to you like it's just a kabagalan issue or a worse issue like corruption? How is it looking?
It will be
at the
difficult.
moment?
Yeah, it will be difficult for us to judge that because what we have are the findings, and the findings are subject to, my goodness.
Sir, yung cameo na
Yeah.
yata.
How do I proceed?
Start video.
Yan.
Yes, sir.
Yeah.
Oh, yes, okay. Thank you. So, the situation is that ano ba yung tanong?
Kabagalan ba yan o irregularity ba yan na
actually, at this point, we can
function
give
of kabagalan or...
Yeah.
Yeah.
Well, Lucy, we can give the benefit of the doubt that kabagalan. In fact, the COA said that there is no corruption at this point involved. So take it from COA. Although they don't have to say that because the COA should not have to explain whether it is corrupt. They stand by their findings. There's a finding deficiency. So that is the finding deficiency. And so therefore, we should be able to wait until they would be able to submit their papers to COA.
Okay. House Deputy Speaker in Cagayan de Oro 2nd District Representative Rufus Rodriguez. Sir, maraming salamat po.
Thank you. I always enjoy.
Salamat, sir.
Yeah, thank you. I always enjoy to be in the Chiefs. Thank you very much for
Kawarin po.
the invitation. Thank you very much.
Thank you, sir.
So uulitin po. And
Of
that will be
course.
all for this special edition of the Chiefs, but we hope it was discussed here. We'll keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Robbie Alampay.
I'm Ami Paminton of the Philippine Star.
I'm Yuchi Cruz Valdez of News 5.
I'm Ed Lingao, and we are One News.